Pfizer shows its coronavirus vaccine is more than 90% effective. The drug maker analyzed the first 94 confirmed cases of COVID-19 among its more than 43,000 volunteers and found less than 10% of those infections were among the people given 2 doses of the vaccine instead of a placebo. Joining us now is Dean Finelli, who is a partner in the Intellectual Property Department at Seyfarth Shaw. Dean, good to have you here with us today. How significant are these numbers?
Good to join you. Well, it's very promising data. You know, the U.S. FDA earlier this summer put out guidelines where they were looking for 50% effectiveness. Now, certainly based on this preliminary data that we're hearing today, 90% is a great number, and it's very promising. But we have to keep in mind there's still a lot of questions out there, and this is preliminary data. We'll have to see when this comes out in peer-reviewed journals. But certainly a great announcement today.
And so specifically as it would relate to the rollout for a 2-dose vaccine versus a 1-dose, how do you think that that would impact the distribution of the vaccine?
Yeah, so you have to keep in mind that, as you mentioned, these are 2 shots, and the Pfizer vaccine candidate has to be kept at ultra low temperature. So, there's logistically, this is going to be a challenge, keeping this at minus 90 degrees. And keeping it stable is one thing. Having people come back for that second shot, and as we see more vaccine candidates being approved, making sure they come back and get the correct second shot. So there are a lot of logistical challenges, but the U.S. government's already been dealing with this ahead of time, making plans on how, once this is manufactured and once this is approved, getting this distributed out as quickly as possible. So I'm confident that, as this vaccine moves forward and the additional vaccines move forward, the logistics will also move pretty smoothly, but it will be a challenge.
As you mentioned, Dean, preliminary data is what we're looking at right now and what's been reported. And so what are some of the next steps that you're going to be watching, particularly as it relates to getting more data from these studies that are taking place?
So certainly we want to see, all these companies, including Pfizer, have been very transparent. They've been getting the data out very quickly so that people can review this, other scientists can review this, but certainly it's been very promising. And what we'll want to see is, certain questions you want to ask: how long will this confer immunity? Is this 90% going to last? Will it be a lifetime, or will this be a situation where we have to come back similar to the flu and get a shot every year? So there are additional questions that have to be answered. But, when we think about how this process has moved, Pfizer's a world-class organization with some of the best scientists in the world. People should be reassured that, we're getting this data incrementally and it's coming out and everything looks positive. The scientists internally at Pfizer, as well as the U.S. FDA, will scrutinize this data inside and out. So once we do see an emergency use authorization, maybe this year, or ultimately an approval next year, I'm confident that people should be reassured that this is safe and obviously that it will work very effectively.
Something of a question that we've continued to watch play out over social media and in some of our discussions today, a clarification perhaps that people are seeking in terms of a detail that Pfizer did not take funding from the government's Operation Warp Speed. Should that inspire more confidence in the results?
Yeah, certainly. So to be clear, Pfizer didn't take any money for the research and development. I mean, as most people know, they received $1.95 billion in a supply agreement to supply 100 million doses to the U.S. With an option for 500 million more. But as you mentioned, the fact that, like I said before, Pfizer's a world-class organization. They don't need additional incentives, so to speak. But, the fact that they didn't take money from the government should dissuade any people that think, perhaps there's some political pressure that comes with that money. But, I can assure people, the way these companies work, they want to make sure safety is of the utmost importance. And certainly they want to make sure that once a vaccine is approved, that it works.
And so what we had seen previously from some of the other candidates that are out there, the companies at least have been, one of them, and the name is escaping me, excuse me for that, but perhaps you can enlighten us a little bit around it. One of them saying that they would not be seeking patents or enforcing patents, rather, in the first year that we're seeing a vaccine rolled out. Do you expect that to be the way of the future for, at least in the interim, for some of the companies that do announce their own vaccine candidates and the data that comes along with it? Should it be successful enough, will they effectively open source their own research and development so that it is more available to really combating this coronavirus pandemic?
Yeah, that's a great point, and there are patents around some of the technology here, and there have been some patent disputes around the underlying technology. But certainly, I can't foresee a situation where, we would be in a situation where we have a candidate that works, that's safe, and that we just can't get on the market because there's a patent dispute there. There would be a settlement well in advance, I'm sure. So of the things I'm concerned about, I want to see this rolled out effectively, make sure it's safe. But, there are patents there, but I don't see them as a barrier to entry, especially in the short term. This is not going to be a situation where we can't get people vaccinated because there's some patent dispute going on.
Sure, and it was Moderna with the patents, just to clarify that very briefly for our viewers here. As we now are in a period where the U.S. is looking to turn a page politically, we're going to be looking at a different way of perhaps dealing with this virus, and President-elect Biden and Vice President-elect Kamala Harris have already started to put together their team, and the transparency is something that they've talked about quite a bit along the campaign and along their own response and what it would have looked like for the coronavirus pandemic. How do you affect that? How do you effectively implement a transparency like they're looking to do, and how does that really accelerate the acceptance of a vaccine once it is available?
Yeah, great point. And I think, we need a uniform, all along what we've needed was a uniform, cohesive message where, even we saw different states having different mandates and, this argument over wearing a mask, not wearing a mask. So I think it's going to be, I think there's going to be much more of an essence on, let's let the science dictate. Let's not have these underlying squabbles over, whether masks work or they don't. And, we've seen today earlier, the governor of Utah has, basically put out a mask mandate. So Republican governor saying that. So I think a lot of, that in the past, there's been, this arguing, this politicization, a lot of that hopefully will go to the side or in the background, and we'll just let the science dictate, because that's what's most important here.
All right, Dean Finelli, partner at Safe Shaw, joining us here today. Thanks so much for the time, Dean. We appreciate it. All right, guys.